Let me ask you a little bit about your treatment. What is that like? Tell me about its effect. And you and I have talked about this a little bit before, but let's jump into not just what the chemo is like, but what you opted to use, for example, something called Red Devil versus radiation, and then some of the effects that you noticed, night sweats, obviously hair loss, we're familiar with that, but you mentioned there were like other sort of pain issues that you weren't anticipating.
Right, so Adriamycin, aka the Red Devil, is like widely known as the most powerful chemotherapy drug on the market currently. Doesn't it? It does a fantastic job in a lot of cases with killing a lot of different types of cancers, from the way I understand it. From the injection of it to the side effects of the four chemotherapy drugs I took, it was not easy. The hair loss was a big thing. Initially, the first rounds of chemo I didn't experience right away all this hair loss.
Hmm.
But over the months I was taking it, it just kind of built upon it. The side effects are pretty uncomfortable. They're not fun. It's everything from the nausea, sorry,
Yeah.
not having an appetite, potentially needing to vomit, at random times because you have all these chemicals in you, the fatigue because your body is fighting this cancer, you're getting all this chemotherapy, all of that. I mean, was very real. Additionally, there were risks that with bleomycin specifically, it could cause scarring of the lungs, which would be a very serious side effect. I had like dry mouth, and
Hmm.
then because I had a dry mouth, I developed these sores in my mouth. So even with the sores, talking, eating, it would hurt. With the hair loss, your scalp would get irritated. So it was a very unpleasant thing. I would say one of my cousins, she sent me a hat. I think a few people actually sent me some hats throughout my treatment, and I thought that was a great gift
Yeah.
because as my hair was thinning out, every day you'd wake up and there's hair on your pillow. Having like a hat or something to kind of not only protect you from the Miami sun or just the weather and stuff, but also just kind of hide the fact that my hair is falling out. All of these treatments, from my understanding, have side effects, and you have to carefully weigh the pros and cons of those,
Yeah.
especially for me as a younger patient. The long-term side effects could include like derivative cancers of other kinds because of how just brutal these drugs are. And
Let me ask you a little bit about that. You mentioned, you were young. You were, 21-ish when this happened, and you're still young, but you brought up a good point. You had to think about what was coming, sort of what could potentially come down the road. I want to spin off of that for a moment. There were, I should say, experiences that you had as you were going through this that you were unprepared for, and you were looking for information and you couldn't find any out there, which was shocking. But one of those particular issues was for young men. We hear a lot about pediatric cancer. We certainly hear about cancer in people who are, older, but your age group, there's not a ton of resources directed at you. Information about things that you should be perhaps considering, down the road, dating, marriage, like how this affects you. And tell me a little bit about that and that challenge.
so one of the other side effects I forgot to kind of mention was the impact on potential fertility. For me, I always kind of dreamt of becoming maybe a dad someday, or have being able to have a family if I choose to, right? And if things work out like that, the drugs, the treatment could render me infertile.
Yeah.
So it's like even if you beat cancer, it takes away your ability to potentially have a biological, family. So that was tough. I had to go to a fertility doctor to bank biological samples and things, evaluate the risks of that. Thankfully for me, it seemingly worked out okay. I don't really know. I mean, I'm not trying to have a child right now, so I'm not really sure. But I mean, even that was hard. I know it can affect women as well, especially younger women. It's tough. As far as like dating and such goes, the immediate time frame of treatment and then even just some time after treatment, you're faced with a different perspective on life. and different fears and things, and you've gone through a lot. So it was hard for me to even kind of going back into the dating scene. I felt like there were women who I've told about what I was going through or had just gone through. They did, it's no fault to them, but they just that you can't comprehend it. I mean, you have to experience it to truly understand the full effects on an individual.
Do you feel like you were sort of like written off, almost as like I remember when we first started talking, you were like, I'm sort of afraid to talk about this. Well, how do I explain it? And will they think like, oh my gosh, I'm getting involved with somebody who's, sick, and all of these things that are sort of swirling around. That's hard to get, answers or have anybody help you sort of navigate through that. How do I weigh it? I mean, was that also an issue?
Yeah, so there's a lot of resources online and available, and even through the healthcare professionals themselves. They can guide you through a lot of the technical medical aspects of the journey. But as far as an individual, especially, I can only speak to what it's like as a young guy. Even just a woman being like, "Hey, you have like a couple scars, like."
Yeah.
What's up with that? Or you said you had cancer, that territory is not widely advised upon, with fellow survivors. So I did not really know how to go about things. Before I started becoming public and becoming an advocate, part of my decision of weighing of like whether or not I should do this, because in my heart I knew I wanted to help people. Part of it was if I go public in order to help people, like how you and I were talking earlier. Well, if I meet an incredible lady, a lot of young ladies these days, they'll Google you, they'll make
Oh
sure
yeah.
you're not like some crazy person. And I was like, well, that's gonna probably be brought up, and I didn't know if like would that end opportunities before an opportunity could even form, and with work as well. I'm lucky to have worked with great companies and compassionate people, but I've also spoken with patients and survivors who it's hurt them even after you're done with cancer or you're going through it. It's like it's always a part of your life. I struggle to this day about when if I were to meet an incredible young lady who I'm interested in or something, and we go out and we're talking about, well, what do you like to do? What are you passionate about? Of course, I'm passionate about my professional life and all the professional work I do, but part of me, I'm extremely passionate about doing initiatives like this and helping patients, but I don't want to scare anybody away because there's not a lot of resources available and literature out there about what it's like. And for me, I guess my candid feeling would be I just fear that they might think that, well, I don't want to emotionally invest myself into somebody who is sick or may die. And there's Hollywood films kind of about sort of like this topic. It's a real thing, and I just don't think there's a lot of resources out there to help you navigate that.
Where did you find those resources? I mean, was it friends and family, or was it difficult to talk to them because of their, emotions or feelings, or where did you find that support?
I just kind of did it on my own. In retrospect, if I had to do it again, or if I was put back in time with what I knew now, I would say, talking with a therapist
Hmm.
could potentially help. Doing things like the Richard Reyes Foundation is doing. It's hard because when do I tell? Like, how do I be honest about myself without scaring somebody off? Or even friends. Like when I was going through treatment, I really didn't communicate with a lot of my friends from school about it because one, I feel like they didn't know how to respond to it. I mean, there's not a lot of resources, I feel like, for young people on how to properly help or support their friends. And there's a lot of misconceptions out there too, because I feel like the stereotype is, oh, you're older in life and you get cancer and then you may die from it or something.
Yeah.
I did not think that there was really any focus on somebody in their 20s or 30s or even in their late teens
Yeah.
for how to navigate socially, but there should be, and that's what I want to help with.
Resources that people should know about. I know there's not many perhaps, but are there online groups or chat groups, or like where would somebody begin to try and find their people, if you will?
I felt like the people who understood what I was going through and who could potentially relate to me were fellow patients, whether they had Hodgkin's or they had some sort of non-Hodgkin lymphoma, or another type of cancer. Talking with other patients around my age was extremely beneficial. I
Hmm.
know that online, like through websites like Reddit, through other charities and foundations and such, they have like they have communities out there that you can meet somebody who's kind of like you.
Yeah.
They can understand what it's like. But that's just the beginning. I feel like that truly there needs to be a understanding of a lot of these cancers are not caused by what the individual does. Nobody asks for it. Nobody wants to be in that position, and you shouldn't, think differently of them because they're sick. My approach to the whole thing was maybe not immediately, but while I'm getting to know somebody, I'll open up about that. And if for whatever reason they decide that that wasn't, then maybe it just wasn't meant to be, because I think all patients, even male and female, should be just accepted as who they are and what they've been through.